places, and I think, so we have the right context. I run a safety net facility. We have a catchment area of over 1 million people, largely immigrant population. 70% of the population is on public insurance. And the reason I'm setting that context is because as healthcare organizations, particularly hospitals, medical centers, do we really know our communities? We have been the dictators of what the health should be, as opposed to listening to the community and letting them tell us what the problems are.
So more patient-centeredness.
Exactly. That's been a major, major problem. And a perfect example, my institution, when I got there, they had lots of clinics, but the clinics were open from 10 to 2. What patient is going to come between 10 and 2? We had no evening clinics, we had no weekend clinics, which, thank God, we've changed. But that's a perfect example. You may call that innovation. I call it common sense.
Of course. Sometimes that's all it is.
Yeah. But the point being, there are lots and lots of technologies that are emerging in healthcare. The question I always ask myself, do we need it? Who is driving this process? Have they asked the end users, is this something that they can actually use? Another example, we have a very high incidence of congestive heart failure in my community. And people can't afford their Lasix and other medications. And so we see readmission, readmission, readmission. And so we took a very innovative program from rural Kenya, and we started handing congestive heart patients scales. We would give them their weight, and we would say, if you put on 3 pounds or if you put on 4 pounds, you come directly to the emergency room, we'll put you in an outpatient clinic, we'll give you your Lasix. And believe it or not, those admissions are going down significantly. Is that innovation? I think that is innovation.
It is.
And that came from rural Kenya.
My point is
And that we're using it now in first world United States of America. I do think there are some things that will be very, very valuable in the future. The fact that now we can video a patient at home. You can actually see the patient. You can ask a diabetic about their feet, and you can actually see it. You do have EKGs now that you can pick up your smartphone, and you can know when a patient is getting in trouble and so forth. Those are things I think that we need to test, we need to do serious studies on, because right now everything is pretty anecdotal. But the key thing is listening to the patient. The patients are going to tell us, as one of my mentors told me, the patient will tell you the diagnosis 85% of the time if you're willing to listen.